We're going to be performing a self-FADIR test, F-A-D-I-R. And with this movement, we're assessing how well my hip can move into some provocative positions, pinching some structures into my hip. It's not the best test in the world to assess for pathology, simply because it can create pain in a non-pathological hip. So we don't really use this test as a make or break style treatment, more or less trying to clear and see if you can do it into excursions that are not reproducing your particular pain. So in order to do this, I'm going to be on my back. I'm going to move my hip into those positions that this name is derived from. So I'm going to go into flexion, I'm going to go into internal rotation, and then I'm going to pull my shin into internal rotation, and then I'm going to grab my knee and pull into adduction, ADD, towards my opposite arm. So as you can see, I'm flexed. I'm going to pull into internal rotation and then pull my knee towards my opposite shoulder. And that creates a little bit of a pinching sensation into my hip, which is common. What we're looking for is a recreation of our typical hip discomfort with that movement. And then we can compare side to side to see if I do or don't get a similar type of sensation on the opposite side. So again, flexion, internal rotation, and pulling towards the opposite side. You can see from this angle, I'm pulling my hip out, or my knee out into internal rotation with my outside hand, and with my opposite hand, I'm pulling across my body. And that can typically create a decent amount of discomfort into my anterior hip.